Welcome to The Wing, the emotional and financial health check you never knew you needed.
Hello, ladies. Welcome to another episode of the Wing podcast. Today we have our guest, Kylie Faulks, with us. Good morning, Kylie.
Morning, Katey.
Kylie has been very sought after in not only her professional network, but also through this podcast, because I have revealed that I was going to be speaking with Kylie to a few people, and they've been very keen to hear what she has to say. Now, Kylie is a women's physiotherapist, is highly educated in the space. She has 3 beautiful kids of her own. Our husbands work together, so that's another lovely connection that we share. But to begin with, Kylie, I'm going to throw to you to give our listeners a little bit of a bio on yourself, on your business, and on your profession.
Thanks for having me. Felt very privileged to be asked to be on the podcast, so it's nice to be here. So as you mentioned, I'm a women's health physiotherapist, and I'll probably get into what that really means a little bit later, but it just means from a broad spectrum that I've done an extra layer of study in the area of women's health. So everything relating to pregnancy and postpartum and the pelvis, but then just also key milestones across a woman's life and a lifespan. I did most of my training here in Canberra and then completed my master's degree in Curtin or at Curtin University in Perth. I was lucky enough to meet my now fellow colleague Tanea Cato as we journeyed through going to publish through a journal article together. The journal article was on rates of incontinence amongst elite female rugby union players, which is quite a niche little topic, but has really created a bedrock for not only the clinic that we've opened here in Canberra, but also some of the professional development that I've done moving forward. Tanea very graciously moved her life across from Perth to Canberra, and we opened our clinic here in Canberra in 2021, I believe, so mid-COVID, which looking back now was both a blessing and a curse, I guess, because it really peeled everything back to just see what the appetite was like in Canberra when it came to women's health physiotherapy. Obviously, everyone was in lockdown, and so it really tested whether it was an essential service or not, and turns out it is. Surprise, surprise. We are now entering into our 5th year being opened. We've recently branched out into women's health nutrition, and we have the fabulous Ellen Bruce on board with us, and she's highly educated and highly knowledgeable in the field of women's health. And it wasn't an area when I first started that I had my finger on the pulse of at all. But the more I hear from Ellen and the research that's out there in that space, the more that I am starting to appreciate how important it is. And it really allows us as a clinic and clinicians to treat the patients that come through our door holistically from an inside out type of lens. In terms of the clinic, women's health is a specialty that is in addition to the general physiotherapy, what you would consider to be general physiotherapy. Most of the women's health clinicians have gone on to do extra training in some form or another. So there are some physios that have done certificates, others that have done their postgrad, and Tanea and myself who have done a master's qualification. The area itself really focuses on lifting the veil of some of those more intimate concerns that women have throughout their life, and concerns that perhaps aren't spoken of much at all. And we're certainly seeing the benefit of things like Instagram and some of the social media platforms and podcasts like yourself, Katey, where we are just having a platform to speak of these concerns and perhaps lift some of the veil on whether this is a topic that should just be shoved under the bed, or really actually bring it out into the open and kind of realize how many women are suffering from particular things, whether it's endometriosis, perimenopausal, postmenopausal, incontinence, the list goes on, to be honest. To really just take the weight off the shoulder of women who are suffering with these concerns and just give them a place to rest and some guidance on how to manage these conditions.
Thank you, Kylie. That was a very lovely bit of detail on what you actually do, because I think a lot of the misconception or maybe misunderstanding or lack of knowledge in the space that women don't actually know that they need they need you. They need this service.
Mm-hmm.
And
Mm-hmm.
it's not always spoken about in as much detail or as in too much depth. So I think it's really important that we're bringing it to the forefront and letting women know what it is and what are the types of things that we struggle with, throughout our life cycles. Like you said, like it's not necessarily just, pre-pregnancy, pregnancy and postpartum. Is, we're women for life. So being able to touch on different aspects and the very niche example that you gave in women's rugby, like how that's something I've never personally heard of, and something
No.
you wouldn't know that would need to be uncovered or studied to a degree.
It was an area that I sort of, I guess, fell into, but that's the wrong term. My sister was an elite level rugby player, and she actually came to me with the concern, suggesting that a lot of the girls were telling her, she was the captain at the time, that they were having incontinence on the field. And that was the first time my brain really went into the area of athletes. And whilst most of our clinic is just for sort of the social, recreational fitness lover amongst women, we also do specialise and give guidance to elite athletes, because when it comes to things like incontinence or pelvic pain, even pregnancy, unfortunately, it is seen as a barrier, and perhaps not long ago a reason for women to really just stop exercising or stop performing at the level that they loved performing at in a sport that they enjoyed performing in altogether. And I guess my main motivator, really, when I think about why I'm doing this job, is to remove those barriers for women. I think there's enough barriers out there, and health concerns that pertain to the pelvis really should not be one of them. The research in this space, whilst it is growing, it is really positive, and there's so much out there now in terms of information and intervention that can really help women. That gets me excited and allows me to deliver the message that there's no reason for us to not live a full and healthy, happy life, whether it's continuing an exercise, going out to social situations due to, incontinence or a prolapse or something that actually, if we just speak about, there can be a lot, done for it.
Exactly. It's a lifelong solution. It's not, and it's so complex because every woman is different and every situation is so different. So
Absolutely.
Kylie, would you be willing to have a little bit of a chat? Tell us a little bit more about your family and a little bit more about your pregnancy journey or pregnancy's journey in as much or as little detail as you wish.
Absolutely. So from a broad lens, I have 3 incredible children, and they're all in their own right extroverted and a little bit spicy, I think the way that we like it. They're very vibrant. You certainly know that they're in the room. There's no question about that. Our pregnancy journey, though, I guess this is something that not a lot of people would know about me, started in 2013. We were very grateful and lucky to fall pregnant quite easily with a beautiful little girl. And for the most part, the pregnancy was uneventful, which is what you would typically expect from a young, healthy mum and dad. But then at 25 weeks, we got the unfortunate news that our little girl was not well, and I was placed in hospital, and she passed away in utero 2 weeks later. I guess, a bit of a shock to both of us, because certainly never expect to be in that 3% of people where pregnancy doesn't have the outcome that you initially think it's going to have. Because she was over the 20-week mark, we were induced and delivered her in 2 hours.
Wow.
I think initially that was on paper and in reality almost unimaginable, in the sense of, how does one go into their first labor knowing that their baby is not alive, and having to go through that discomfort of labor to not get a reward at the end, but you have no choice in that situation. So I got through it with Ben by my side, and we got to meet our daughter. Her name was Miller, and the hospital, in the Canberra hospital, and our obstetrician Can 10 at the time, they were all incredible. You really couldn't fault them. We were very fortunate to fall pregnant quite quickly after that through the anxiety, I guess, of each week that I faced. We ended up being induced at 37 weeks with a very happy and healthy little girl in Addison. So she's our eldest daughter. Labor-wise for her, interestingly, it went much better than it did with Miller. And I think that's a misconception that if you have a smaller baby, then the labor is going to be easy. And certainly that was not my experience. I do wonder whether the outcome was a big reason for that, in that I knew I had a healthy little girl at the end of labor. But again, she was 2 hours and a couple of pushes and she was out. And then after going to hospital thinking I had appendicitis, we then found out we were pregnant with Austin not too long after. So you'd think we'd work out how things are done at that point, but we hadn't. So Austin was also induced at 38 weeks. I think all of my pregnancies were induced, all of my deliveries were induced. That was partly because of what happened with Miller, but also my husband's 6'3", and so my children aren't little. Austin at 38 weeks was 4 kilos.
Wow.
I remember every detail of this one because we had Ken. I think I went in the morning to be induced and wasn't dilated at all. And at 8 o'clock he came in as he normally does, and it might have been it was 8 o'clock. He broke my waters, and I said, "Ken, just do not go anywhere. Please don't go anywhere. This isn't going to take very long." He said, "Don't worry, I'm just going to go and get a coffee, and I'll be back from the cafe." So he broke my waters and left the room. Ben and I got up to go for a walk around the hospital thinking this was going to take a few hours. 10 minutes later, Austin was crowning, and at 8:12 he was born. So it was 12 minutes. And in utter shock, Ken ran back into the room and just said, "What happened?" And I said, "I told you not to go anywhere. Told you not to go anywhere." So I think at that point it was almost a record in the hospital. Not that I would suggest anyone ask for a 12-minute labour, but certainly left Austin, myself and Ben and Ken in utter shock for a few hours after. So that was a memorable delivery. And then Ben and I were 2 and through at that point because we had 2 under 2, which, as you well know, is a shock to the system and took us a few years to recover from. And then we had a lovely little surprise in Elliot, who joined us in 2020. So she's just turned 5, and she is utter magic and glue that really hold our family together in such an incredible way. She is vivacious, 11 out of 10, extroverted, and a really staunch feminist in her. So I do apologize to every teacher I hand her over to, but she was also very quick. She was also induced at 39 weeks, and she was a 20-minute labor. So a couple of pushes and my little lady was out. But I guess in a nutshell, those are my 4 beautiful, incredible delivery stories that I hold very dear to my heart, and appreciate the opportunity, I guess, Katey, to share those, particularly about Miller, because it's obviously in my line of work, not something that I share with a lot of people. It's not a story that I want women who are pregnant, especially for the first time, to have in the back of their mind, because it's not an outcome that thankfully happens very often. It does happen, and it has happened to a few of the women in here, and I am grateful to Miller to have graced us with her short presence here, and I'm really grateful that I can offer some support and guidance and knowledge to the other mums who have to walk down that path. It's not one that you want to walk down, but at the end of it, there's always some beautiful lessons, some beautiful perspective, a huge amount of gratitude and just blessing that they were here. But it does take some time to get to that point, I think, emotionally for women. So, she's celebrated in our family every year. The kids all know about her, and certainly enjoy sharing her story whenever we have the opportunity.
Thank you for sharing that, Kylie. It's a deeply personal story, and I imagine not a necessarily easy one to speak about. And I think, having the forum to be able to speak about it and having the courage to speak about it is very moving. I think in
Mm.
your line of work, as you said, in particular, coming across women that are going through the same or similar situations, and you're able to be that, be that person that they can lean on for, advice or nurturing, and, not just physically, but mentally and spiritually, emotionally, like in all the ways that it hits you. Very grateful for you sharing that. I'm glad that this can be a platform for it.
Me too.
It's nice. And I think it's lovely that Miller is celebrated, particularly amongst the kids. I think that's that's a very nice way to have her included in the family, because, she's still part of your family and always will be, albeit a difficult, extremely difficult situation. Not even the right words for it, but I think that's really beautiful. So thank you, Kylie.
A pleasure.
I want to ask you as well, throughout your varying pregnancy journeys, were there times where you were seeking services as such that you provide right now? Is that something that was available to you at the time? Was that part of your motivation to go down this road on your professional journey?
So I think the short of it is no, it wasn't really. It certainly wasn't promoted. If it was available, it was not. It was not promoted, and we've seen a huge shift over the last 10 years, where most of the specialists now, particularly the obstetricians in Canberra, know about us and support us, referring their patients to us, almost exclusively if they've got some concerns. So that's been a really positive shift in the space. But no, it wasn't something that I sought out. It wasn't even my motivator. I think I had decided that women's health was a space that I was passionate about at a much earlier stage during my undergraduate studies in physiotherapy, and not a glamorous topic whatsoever, but I think it had something to do with learning about the rates of incontinence amongst women. And certainly incontinence is something that for most of us we don't worry about until we've had delivery, and it suddenly sneaks up on us when we sneeze or laugh. But learning that particular condition was one of the main reasons why women in their elder years are admitted to facilities like aged care facilities, and it can lead to some really life-threatening conditions for these women. And I was looking at all of the data and the treatment that was available that really wasn't being promoted, and just the efficacy behind that confused me as to why it wasn't being promoted. But it also really motivated me to share that with women, to say this is really quite easy intervention for the most part. If we look after our pelvic floor as much as we can, then yes, it's going to help us stay active in our middle ages and our antenatal journey. But more than anything, it really is going to promote longevity for us as women. And I think it was an area that just wasn't being spoken about. So that got me on my feminine soapbox a little bit to just shout this from the rooftops that it was available.
That's really interesting. Something you said there, Kylie, about that it's actually one of the main reasons that women in their older age are admitted into aged care. That is phenomenal.
Absolutely.
That is
Isn't
crazy.
It? Yeah.
And you think,
and
wow.
Sorry, Katey. Yeah, such a slippery slope, unfortunately. I mean, we know that muscle strength and the number of myofilaments as we age, it starts to decrease. So we are in our 20s and 30s, we really want to be promoting that pelvic floor health and strength and function, so that as we do head into our postmenopausal years, we have a solid base and understanding of that area that's only going to promote health long term. But yeah, these women, and I think, we are seeing the effects of perhaps just perceptions of women's health conditions in our mother's generation and generations before that just weren't spoken of. But we're seeing those women who didn't have the chance to train their pelvic floor or care for their pelvic floor, and really how much that impacts their lives. But if you're having to race to the bathroom when you're 92, the risk of fall and then having for example, a hip fracture really decreases your life expectancy quite significantly. So there's flow-on effects that aren't obvious when you first think about it, but they are certainly there. And the intervention, as I keep saying, for most women is quite easy and really effective.
It's phenomenal because these things that we can do in our younger years can really impact how the end of our lives look. And being shuffled into an aged care facility, perhaps before you're otherwise physically, mentally, emotionally ready for it, can do, like, the flow-on effects would be significant.
Enormous. Yeah, enormous.
Absolutely.
Enormous.
Some topics, Kylie, I got these from your Instagram page. So, and
yay.
they're topics that are obviously spoken about in clinic, but I want to speak about them on here because I feel like this has been a nice snapshot of the reasons why. So the top 5 reasons why to see a women's health physiotherapist. So we've got pregnancy, related aches and pains, incontinence, which you've touched on, postnatal recovery, pelvic pain, and abdominal separation. Can you talk us through these?
Big one. I'm going to start with abdominal separation because it just seems to be on everyone's mind at the moment. And we're getting a lot of first-time mums coming in who are pregnant and have, I'm not sure where it's coming from, but quite a lot of concerns around their abdominals separating in pregnancy. I think I really just want to push the message out there that abdominal separation while you are pregnant is normal. And now the degree of separation that you experience will come down largely to genetics, the number of children you've carried, the size of the baby, and then there's some ethnicity factors behind there. But I think we need to remove the guilt and the weight of blame of, I sat up out of bed incorrectly, because there is no data to support that doming increases that the DRA or diastasis, which is the gap of the abdominals. And I think, yes, we do have some women that do have excessive gaps, and we do want to try and support them purely because they can be uncomfortable for women. And also we do know that, you know, the size of the gap will then predict the recovery. But even when we speak about recovery, a lot of the research is moving not necessarily towards how wide your gap is, but how functional that whole abdominal wall can be postpartum. And now leading into pregnancy, I think if you have the luxury of seeing a physio before you fall pregnant, fantastic. We can teach you how to use your core correctly. But certainly during pregnancy, we know that having a strong and functional core will not only help carry the pregnancy well, but will help you during labor and absolutely help your recovery. So I just want to lift some of the fear around this diastasis topic that seems to be coming through the door. I think technically, if we're going to throw some numbers out there, and it will vary, a gap really isn't considered clinically significant until it's 2.5, 3 centimeters wide. And for the most part, when we see women in here at 3 weeks postpartum, everyone is getting very close to that mark, if not already under that. So there's only a small percentage of women that do come in with wider diastasis. And there's plenty we can do conservatively to try and help manage that for them. But I think some of the fear that's around there on social media, but also, you know, trying to lean away from some of the influencers that are perhaps saying, here's how you manage it or here's how you not get one. I think it's worth just making some room there.
Totally. Yeah, because I feel like ab separation seems to be a bit of a dirty word, or it's, you better go to your 6-week check to see if you've got any ab separation, you know, and it's sort of, and then you get the information like, okay, well, you got 2 centimeters of ab separation. So like, okay, well, what does that mean? Does that mean everything's going to fall out? Or
Yeah, totally. Yeah. And I think largely we just need to be okay with the fact that it actually means we have a healthy growing baby, and physiologically our tissues are designed to carry that child and make space for it. And that's exactly what our body is doing. It's an incredible design for us. And for the most part, it really does come back quite quickly within that 12-month mark. You know, a very small amount of women at the end will be left with a significant gap. And I have only seen a handful in my years of being a women's physiotherapist. I think just be very careful too of people who are really wanting to prey on women and find a space to sort of, they know that everyone gets a DRA. So if there's programs out there about it, just be really diligent with your background checks and who's writing them and where they're coming from, and actually is diastasis an issue that you need to be concerned about or not.
It's not like you're going to fold in half and fall over, and if you've got a little bit of
No, you're good. Yeah, your body is incredible. It will find a way to do most things.
We are built for this.
Pelvic pain, that would be the other space that we're seeing a lot more people come into the clinic to address. And as clinicians is probably one of the most rewarding areas, and one that I share, my good stories that I share with Ben at the end of the day. If we were to outline a typical patient, it would be someone in their early to late 20s who perhaps has suffered from pelvic pain, and specifically pain with intercourse, since the first time that they've tried intercourse, not knowing that it was abnormal to experience that level of pain. And they've just gotten to a point where they've either been diagnosed with endometriosis or a condition called vaginismus, and they're really at a space in their life where they're wanting some help. And thankfully, physiotherapy is just one of those areas where we've not only been educated on the management well, but we also have some really solid data to support the intervention. It's actually first line intervention and considered that globally, with a good level of evidence for those women. Often we get them coming in and they haven't been able to use a tampon before, or they haven't been able to achieve penetrative intercourse. And by the time their treatment is finished with us, for a lot of these women, they're back enjoying intercourse, which, is a part of life that I think needs to be celebrated and needs to have a good amount of focus on for our young girls. And I'm really pleased to see that when they're not able to achieve that, they're actually sort of putting their foot down and saying, no, I deserve to have that space as a part of my relationship and a part of my life. And I want it to be a happy space that isn't clouded by anxiety or pain, and they're coming in and doing something about it. So the pelvic pain girls are celebrated in our clinic heavily. And we love when they walk through the door.
It's so nice to hear that too. That is through such a different lens. Like we're talking about sex here, and that's not usually a way that would be spoken about. But I think having not a great experience in that realm of your life can impact you in so many other ways. And you touched on it, like anxiety being one of the things, or impacting the relationship that you have with your partner, or the way that you view yourself, or, there's so many dynamics, particularly in young women, that, it's sort of, it's a very impactful time of their lives. And then to be able to move through that with you, and with the right education and the right treatment and then also taking into account the other factors that, that, like you said, it could be endometriosis or PCOS or what other things. It's just that awareness piece on, hey, we are females, and we have, these parts of our body that we need to pay attention to. And if something doesn't feel right, then it's probably needs some different attention. And to know that seeing a women's health physiotherapist is something that is useful.
I don't want to put the spotlight purely on physiotherapists in this realm. It's very much a multidisciplinary approach, and we work closely with the gynecologist or a urologist, or even an obstetrician in this case, or a fertility specialist to really and the GPs to help these girls just get to an outcome quickly. Because I think the data out there in relation to endometriosis is somewhere in the realm of 10 years of pain before we actually get an official diagnosis. So the whole team is really on board to try and resolve this and find the source of the discomfort for these girls before we can then approach an effective management plan. We generally see really positive life-altering outcomes for these girls, and Tanea and I really enjoy treating them for sure.
Yeah, and having this information early, and like you said, working with other health professionals in the realm that you're able to, bounce off one another and figure out the right management plan for these patients is so important. And I think leading into, what the changes that happen in the body, pre-pregnancy, pregnancy, and postpartum, like, the pregnancy-related aches and pains as another topic, another reason to see you, and that postnatal recovery period as well. Like, do you find that some of your clients is sort of, you've seen them through that whole process, or is sort of are there any more dominant sort of times that you would see women?
Yeah, I think that's one of the great things about our role in women's health physio is that we really do get to see patients on this whole journey. And Tanea was only saying the other day that she's got a patient back for, I think, her second or third pregnancy, and just how much joy that gives us when we're seeing these patients come back again and their family growing. And perhaps, they did have endometriosis or pelvic pain to start with, and we're now seeing them on their second or third child. So, we have created a bit of a family, I guess, in here, and the girls that come through the door always feel like it's a space where they can rest and get the support that they need, no matter where they fall on that journey throughout their life. But prenatal and postnatal, I think, would probably make up the bulk of our clientele through here. And I'm really pleased to see that, because like I mentioned, it wasn't that long ago before these areas, it was sort of seen as less severe than a rolled ankle, I would probably put it, in the sense that you have a baby and go home and, manage it as you will, but there's no one that's going to guide you on that. And that was, for me, being reasonably active in my life, just, seeing how unfair that was. I was like, well, we're going through one of the biggest, most incredible changes a body will physically go through, and legitimately just delivering life. And then we're expected to go home and, for the most part, accept the changes to our body and assume that it's healing well and get back to exercise at 6 weeks, and have everything together. And I thought there was so much injustice in that. Starting to see a streak of fairness in me, but something that we are really passionate about in here with our girls, which is just supporting them through those changes during pregnancy and postpartum when it comes to how the body is going to respond. And as you've mentioned, everyone is different, and what we see in every pregnancy amongst individuals, but then again between individuals, is really different. But just encouraging girls to give themselves some grace and make some space for those changes and celebrate those changes, rather than perhaps fighting them and seeing them as their life has now been altered in a negative way. And we've really pushed that message in this clinic to just try and have a lot of gratitude for the incredible phase that you are in, the season we call it, that you are in, which is pregnancy and postpartum. And yes, we're here to support you, and we are going to put, a stake in the sand, and we will get you to where you want to go postpartum. But to understand that there are steps that are necessary to take to honor the body, to make sure that it heals the way we want it to heal before we can get there. And for some girls, it's, nudging them gently to say, actually, you can exercise during pregnancy, or you can exercise postpartum, and don't wrap yourself up in bubble wrap, because it's good for the baby, it's good for you mentally, and with so many benefits of exercise throughout pregnancy and postpartum. But for some women, it's actually, hang on, we do need to put the reins on here and just pull you back a little bit. So we're going to provide you guys with some bumper bars as to, we're heading in the same direction here, but let's just swim in this zone to keep you safe and to honor your body, to make sure that we get there.
Having that in mind as advice, to know that you are still a priority after you have your baby. Yes, your role as one of the primary caretakers of your baby, or the primary caretaker, is to be there for your baby. But you've got a lot of we have a lot of recovery to do. And I've had that conversation many, many times of just, this is like this ever since I had my son, or this is like this ever since I had my daughter. Like, it's just something I hear on repeat. And it's many things I've told myself as well. Like, after I had the cesarean with our son, I had that because he was breech. And so that was different to my experience with our daughter's birth. And I just thought, this is just me now. Oh, well, ho-hum, what to do. Like, you just kind of don't.
Yeah.
You think, I feel like this now, I'm going to feel like this forever.
Forever.
And it's just very easy to not only physically be down in the dumps, but mentally be down in the dumps as well about it. And
for sure. Yes. And we've all been there, Katey. And I can empathize with my girls when they come in here, and I get it. And I think there is space for that, to sometimes mourn the person that you were before. But I've really challenged my girls to give themselves time to do that, but then start to see the positives and the joy in the small things. And I think when you start to do that, the gratitude starts flowing, and then your mood very quickly turns around. I think it's a frustration of my colleagues, and perhaps even my husband, that I could look at a piece of concrete and find something beautiful about it. That's because my life hasn't, as I've, put forward to you guys, it hasn't always been easy, and I've certainly had my challenging moments. And I think the only thing that's really gotten me through that is to actually try and turn it around as much as possible. And if it is looking at a piece of concrete and finding something beautiful about that, then that's what I've trained myself to do. And I really encourage my patients to do that. And there are some times where that just feels way too overwhelming, and you can be sad and cry in the shower and fine. But, at some point we do have to pick ourselves up and just acknowledge where we are in this journey, and that it's not a quick recovery from pregnancy, no matter what the Instagram feed is telling you, that you should be back at 6 weeks and you should be doing exercise by then. Sometimes that's just not our space and it's not our season, and that is absolutely okay. I think the postnatal period needs to be cherished and honoured a lot more for our mums. We need to give ourselves a lot more grace and understand that I think research suggests that it's 12 months. I would actually even challenge that and say it's more like 2 years, really. If we're looking physiologically, the fascia that has been stretched and manipulated to allow that child to grow and to birth can take up to 2 years to recoil and find that tension again. We know nutritionally it can take up to 2 years to restore some of those nutrition deficits before we then go into another pregnancy, typically for a lot of us. And so we often just don't feel like ourselves, and that's okay. But we need to be reassured that time will come. And, surround yourself with good people, surround yourself with good knowledge or knowledgeable people who can help you through this, and to not diminish what you've gone through, that it's actually okay to either mourn where you are or celebrate where you are, or just accept where you are, in the sense of it has been a big change and it's a big recovery.
And acknowledging that, I like the language that you use as well, like acknowledging that you're in a season. And if you picture a season, it represents change, and, that it's a limited time, and that, it's just part of the process that we need to trust and not be, I love that. I think that was very, very well said. Kylie, what is the most common misconception about postnatal care that has caught your attention?
This was a good one. I think I've kind of already touched on it, Katey, but I think the thing that's doing us this big disservice is this magic 6-week mark.
Yeah.
And for those of us who have had kids and gone to our GP checkup at 6 weeks and they've given us the clearance to go back to exercise, I think we can all kind of sit back and remember scratching our heads going, but you didn't even check my stitches, or you didn't even look at my stomach, or you've basically just made sure I'm breathing and now I'm about to exercise.
Yep.
That was my experience. I mean, I have an incredible obstetrician who gave me some different advice, but certainly with some of the GPs out there, and that space is getting better. But I think that needs to dissolve. It's time to move on from this magic 6-week, 12-week time frame. And I think if we're going to put some hard data out there, there's been some recent guidelines that have been released, and this is echoed globally, I think, if I pull them all out. And when it comes to something like returning to running, which is a really common goal that we see in here, the data is really suggesting not before 12 weeks.
Right.
And now a lot of women will go, oh my God, there's no way I can't run for 12 weeks. Well, there is a way that you can't run for 12 weeks. And some women do get back a little bit earlier, and I can speak to that if we have time. But it comes down to honouring the fact that your body just isn't ready. You can probably do it, but should you do it? Perhaps not.
And is this in women that have been runners previously, or and then maybe not during pregnancy, or they were runners and they continued to run through pregnancy, or is it women that are sort of like, right, I'm done with my pregnancies, I'm going to take up running now? Like,
back up. Yeah. And I think they're the variables that we as clinicians will sit down with the patient and work out, and I think you're right to address that, in that certainly if they've been running through their pregnancy, they typically can get back earlier. For a nice example, in the case of someone who has had a C-section, we don't have full tensile strength through that C-section incision site until after 12 weeks. And now the risk of something like a uterine rupture is low, but it's still there. And at 3 to 4 weeks, it's only in the realm of 30% tensile strength through that uterus. And we can't see it. We can see that the scar is healing well and what have you, but we can't see what's going on inside. And so we really have to just honor that, and I think err on the conservative side of management as opposed to sort of pushing these girls. Now, in the case of elite athletes, which we've had the privilege of dealing with, there are some considerations to push them a little bit earlier when it comes to exercise, but we also have at our disposal, exercise physiologists and trainers and coaches that can work with these girls, and we just guide them on what's safe and what's not safe. So it's not we're not doing anything until 12 weeks. That's certainly not what I'm saying, but I just wanted to put that running example out there to suggest that globally, everyone sat back and thought, this repetitive impact type work really isn't great for the body within that 12-week mark, and I guess that just honors what the body has gone through. And I sit down with my girls who are really chomping at the bit, wanting to get back to exercise, and they really need to convince me with some solid data and a good argument as to why they want to go back to this particular exercise early. And we're very clear about the risks that might come with that, whether it's immediate risks to them injury-wise or perhaps some risks later on down the track when it comes to pelvic floor and prolapse development and those sorts of things. So it's not a no, you can't do it, but it's a proceed with caution if you're going to go outside of these guidelines.
And listening to the professionals and knowing that professionals are there to have these conversations and guide you in the right direction can certainly relate to some GP conversations where, you literally just go in, they check for a heartbeat, they're like, all right, good to go.
You're good. Get back. Good luck.
I actually had one doctor in the hospital just after I had our son, and he said, do you have any other kids? And I said, he's doing a check to release me from the hospital. And he said, do you have any other kids? I said, yeah, we've got a daughter. Well, how old's she? Oh, it's 12 months older than this one. And he goes, all right, see you next year. And that was all he said. Okay. Do you need to check it in, anything else?
Anything?
Anything?
Good? Am I good?
Can you take my catheter
Go back
out
and have
first?
another baby. Yeah. No, you can do that yourself, Katey. Come on. We need this bed. We need the bed.
Yeah, we need the bed back. Get out.
I know. It's a shame. And look, I appreciate the GPs in Canberra. I think they're incredible. And I understand, that sometimes it isn't their area of specialty. And that's why we're here. But I think just sort of closing out on that point, that sort of 6-week mark, when you're coming in to see us, it's very rare that we say to our girls, okay, reins are off you go. And I just want to sort of put that out there, that it is a guided return. The protocols are suggesting early return, which is fantastic, but not before 3 weeks. So at 3 weeks, we can actually get you doing something. It doesn't mean you're going back to do a half marathon, but it does mean that we're starting you on some pelvic floor care, some core exercises, some upper body work. Rehabilitation can start that early, and then it's just this beautiful graded return back until we have some benchmarks in here that we need our girls to meet before we're confident in getting them back to full exercise. And our postnatal classes certainly help hold a woman's hand or a mother's hand over that bridge of time. But we do just want to honour that space, and we find ourselves educating more and more around the girls of just, it's summertime, why is my waist not the same size? Why am I, not able to get into my dress again? And so for us, it's just softening that and giving the women some space to feel proud about what their body has done, and not feel like they should be in a hurry to get back to 6 weeks exercise, because I think when they don't, they perhaps feel like they've failed or something's gone wrong, and that is not the case at all by any stretch of the imagination. And I think for those of us who have had kids, certainly for me, the 6-week mark, my head was still spinning. For a lot of us, we're not even getting out of the house at that point. So to think that there's a line where we're like, we should be ready to go, I really think that's a disservice to us as women and does not honour the process that our body has gone through, which is one of the biggest changes that we will experience.
And to focus on your own process, not to compare yourself to other people. Like, my friend was back running at 6 weeks, or, she did a marathon when her son turned 1. Like that type of stuff it's not helpful to focus in on your own experience rather than making comparisons.
We all have our own pregnancy journey. We all have our own children. Children are different. Their temperaments are different. Their sleep patterns are different. Their feeding patterns are different. We all have our own delivery stories, and, our postpartum journey is no exception to that. I will say, though, I am really excited to see some of the women pushing the boundaries on this a little bit, because to play devil's advocate, when I was pregnant with Addison, for example, which was 11 years ago now, it was a bit different, where I was like, you must not do anything. Wrap yourself up and don't do this and don't do that. Everything was just this sort of barrier that was in front of you. It was almost scary to exercise in pregnancy, and there was a bit of fear around it, even postpartum. And I think we're getting some elite athletes that are quite prominent online. Also some local athletes returning to some high-level sport reasonably early. And I get excited by that, because what it does is challenges the narrative at the moment and will force research to go down that avenue just to see, okay, what are the impacts? Now, we don't have any data at the moment on girls returning to sport early postpartum to know exactly how that's going to impact the body. So we do have to take a conservative approach to it, which is fine. We are evidence-based here when it comes to the advice that we give you. But it certainly doesn't mean that it's not possible. And I wouldn't be surprised if we see a shift in the next 5 to 10 years of all of those, protocols and procedures that have been released. And I kind of hope we do see it, because the body's an incredible thing, and if it's dealt with respect that it deserves, and if it's given the right guidance, then I do believe that we can all kind of get back or achieve a goal that we want to in the postpartum years, for sure.
Absolutely. Well said. I think just hearing that from a professional in the space, like, it's not just your opinion. This is like, everything you're saying is medically or backed. Like, these are true facts. So I really hope that our listeners are listening to the detail in this, because every journey is different, and there's no reason to discount your experience, and then there's no reason to hang on to the bad bits forever and all the more challenging bits forever, and that there are ways to move forward physically, mentally, emotionally. Kylie, to wrap up, and this is another little personal piece, but I'm wondering if you could give one piece of advice to your pre-motherhood self, what would it be?
That's a big one, Katey. Do you ask everyone that?
Variations of, yes.
Yeah, okay.
I feel like you'd be up for the challenge.
Thanks. This is a big one, and there's so many things that come to my mind, and I think it's because, I'm 11, 12 years into my motherhood journey, and I'm just a completely different person to where I am. So some of this may not resonate with your listeners in the sense of where they're at, and they're much younger in our journey. I think I already touched on it before, and one of the big things, and it's just my motto in life, is to just find the joy, wherever you are, is find the joy in the small things. Sometimes it's hard to find, but it's certainly there, and it can just be a breath of fresh air for you in a moment where it just feels like the walls are closing in on you. And I think if you can make a habit of that, the world's a much better place. And certainly in the climate that we're in now, we can do with a lot more joy. So I think that would be my first piece of advice for my younger self going through this. I think the biggest thing, and this is a hard one that rests on, or a heavy one that rests on my shoulders, and all of us as women have this incredible voice in our head that I refer to as intuition and our guiding light. And I can't emphasize enough how much we need to hold on to that and listen to that as women, because there's so much in the world trying to drown that out. The world is quite a confusing place, and certainly when you enter into motherhood, my goodness, is it confusing and conflicting and anxiety provoking and all of the above. One of the top obstetricians here rests heavily on the mother's intuition when it comes to the health of the child. And I think if I could offer that advice to anyone, it would be to listen to that voice inside and take confidence in knowing that the majority of the time it's right, and use it as a guiding light as you go through the early weeks and months and years and decades of motherhood, to have a strong set of values and morals that will help you, but also be a huge gift to your children when it comes to finding a center point and making decisions in this world. That intuition for me has actually led me to where I am. I don't think I would be here without it, and I'm just proud of myself. And and know that my children have got the same philosophy as I do. And I'm so glad that I've handed that over to them, because I just think that it's very easy to get lost and bogged down in this world of what I should be doing, what I shouldn't be doing, who I should be looking like, and what I should be aiming for. And I think that little voice in your head, if you can listen to it and turn the volume up on it as much as possible, will never lead you astray.
That's a nice visual, being able to turn the volume up on, you know, the intuition and the gut feeling and your values and what your morals tell you and how that impacts your how you develop that and have that present in your family unit. I think that's a really, really nice reminder that, and I agree. I think a lot of the time where, you know, our intuition is dismissed or ignored or quietened down, and, you know, we're led in different directions because of that. But if we can really just sit in that quiet and really listen to what that intuition is telling us, whether that's before babies, being pregnant, after babies, and when it comes to your children, then, you know, listening to them and feeding off them and advocating for yourself and for your family, not to let that go unnoticed. And I think another really beautiful thing, you said it to me in the past, actually, you said, like, when I told you we were having a third baby, you were like, that's good. Just make sure you just sit in the mud with Jake. Just sit in the mud.
Yeah.
And that's just stuck with me. And you bought, when we had our daughter, you bought one in your gift. You gave us it. I've got it on our kitchen bench every day. It says, "Embrace the chaos, for one day it will be a memory." It's on a mug, and I look at that every day, and I just think that's just such a nice reminder to touch on what you said earlier about, you know, just finding that joy, find the joy in the little moments, and try not to, you know, skip over it, because it's easy to do.
It is. And I think, you know, now I've got older children, I do look back at those days when it was just utter chaos and I was in my pajamas with vomit all over me, and God knows what Addie was doing at some point. And they do bring a smile to my face. I remind my husband of it as much as I can, that we are all sitting in the mud together sometimes, and to really enjoy it. And I think, just to close out, also just on that point on intuition, you know, we're more and more, we are drawn outward and to look to what others are doing. And I think that's just the way our society is going. It's this very strong needing to keep up with the Joneses, and it's in front of our face on our phone 24/7. And I just think, whilst there are some benefits to it, you know, just holding some space for yourself and what you need intuitively, it can just quiet down the world a little bit and the noise, and really lead you to where you need to go, not only for yourself but for your kids.
Well said. That's beautiful. Thank you so much, Kylie. I think that we covered a lot of ground today. It was really nice.
Yes.
Lots of
great.
Thanks,
ground. Katey.
My pleasure. I think a lot of value is passed on now through this podcast. And I think, now I listened to the requests, and yes, we got Kylie. So hopefully we get some value for our listeners there, and that you enjoy the episode. Kylie, if our listeners are to find you, where should we direct them to?
Look, we've got an Instagram page, and we've also got our website, just Kylie Faulks Women's Health Physiotherapy. We've just launched our postnatal classes with the exceptional Hale Gym and Spa up at the Brassy. So we're really lucky to be working with such an elite boutique gym up there. So we welcome anyone postpartum to come and inquire about those classes. Equally, you're more than welcome to reach out to myself or Tanea. Just info@kyliefaulks.com will come directly to us. I'm happy to answer any questions.
Perfect. Well, you have it there, ladies, and I'll also include the links and relevant details in the post on Instagram on the Wing page to Kylie's page, so that you're easily able to find her and Tanea and reach out for the help that you may certainly need. So thanks again, Kylie. Really appreciate it.
Thanks, Katey.
My pleasure, and we'll see you all again on another episode of The Wing soon. Thanks, ladies.